Dear colleagues, my name is Nazariy Mykhaylyuk, and today I'm honored to present for you about digital workflow. Before I start demonstrating clinical case, I would like to introduce myself. I graduated in 2010, and at the beginning of my career, I was doing everything in dentistry. So basically it was like a mixed approach. So I was doing direct restorations, indirect restorations, I was doing hygiene, endodontics. I mean, just like mixed fighter, let's say like this. But in 2010, I also got a chance to try using microscope first time in my life. And starting from those days, I implemented microscope in my daily work. Also, I understood that it is impossible to learn everything by yourself. That's why, in dentistry, that's why I decided I want to focus only on prosthetics. So I was really enjoying doing the smile makeovers all this time and full mouth reconstructions. And today, of course, we will speak how we combine the digital technology together with the microscopic approach in dentistry. But it's very hard to be a good prosthodontist, and you all probably agree with me if you're alone, because it's very difficult to be a prosthodontist if you don't have a good team as a lab. And in my case, sometimes I'm saying that all of the clinicians can change their dental technician. I cannot change mine because mine is my father. And I really respect him a lot as a specialist because at the beginning of his career, he was doing metal crowns, then metal ceramic crowns, then pressed ceramics. And then when I told him, listen, we need to move digital, he was completely fine with it. He just asked me, when do we start? So now our lab is fully focused only on the digital workflow. I live and work in Ukraine, in the capital city of Kyiv, and I have a clinic that is fully focused nowadays on the digital workflow. So we have three dental offices, three dental units. We also have a photo video studio in the clinic, and you will see it during my presentation. This is where we collect all the data about the patient, and we create this multimedia copy of our patient to be able to communicate inside of our team and also with our lab and whoever I need to communicate with. So basically nowadays, our brand consists of 4 parts. So it's clinics, Envision clinics. We have Envision International Lab that cooperates around the world. We help doctors around the world with the digital workflow, as well as 2 training centers in Envision Las Vegas and also Envision Asia that is in Kuala Lumpur, Malaysia, completely packed with the newest technology. We do lots of hands-on training. So many years I've been working with the analog workflow, and we had quite nice results. I cannot say that the results were not good, but the thing is that with the analog workflow, it takes lots of time from the lab side, and also you are limited with the time in the office. If you need to redo something, it's also very complicated because everything is handmade. You need to find the same technician, so you have quite a lot of limitations. So this is why in 2016 I decided that I need to go with the next step. I need to move on. And my goal was to work less, produce more, and still have a chance to enjoy life doing the dentistry that I love, actually. And for those purposes, of course, digital dentistry helped me a lot. So which benefits do I get now from the digital dentistry? After taking pictures and videos of the patient, we invite patient to the office, and I grab the scanner and I start scanning the teeth. So I have a possibility visually to demonstrate my patient what is happening with our teeth. And I can show maybe there is a caries, I can show maybe there is a tooth missing, or maybe we need to do the orthodontic treatment for a patient. So visual communication nowadays is on a completely different level with our patients, as you can see over here. Another great benefit is the possibility to copy nature. So nowadays, every single time I have a patient who comes, let's say for hygiene, and I see that they have beautiful dentition, or my periodontist is seeing the patient, we can just grab the scanner and scan the teeth, And we have two great benefits. The benefit number one is we're saying to the patient that, listen, from this moment, we save your library in our database. So whatever happens to your teeth, we can always restore them with the highest precision. Another great benefit is that each library that we create is always added to our lab. So our lab can have more and more libraries and create more and more interesting cases for our future patients. Another great benefit is actually that digital dentistry nowadays, if you have proper tools and if you have proper knowledge how to use those tools, it doesn't have any limits. I mean, you can do prosthetics on teeth, you can do prosthetics on implants, you can do full mouth reconstructions, you can do whatever you want. But again, in case when you have proper equipment and you have proper knowledge how to use this equipment. So let's see how we are moving to the next stage of cooperation between the clinic and also the digital lab. So the thing is, if we look nowadays at the new equipment that we're using in our offices, like in the labs now, they have the milling machines, they have the 3D printers. Also in the clinics, we have the 3D printers. We're using the ray facial scanner because our goal is to create a digital copy of a patient. Nowadays, the face scanning is very important because, again, the treatment is usually aesthetically driven. So we must have a beautiful integration of a case in the patient's face. We all allow, of course, the macro photography, but again, the definition for me personally of the successful treatment is the natural integration of a case in the patient's face. This is why, again, facial scanning is something that we use every single day in our office. Things like jaw trackers. So now, of course, we are able to record the movements of the mandible. So to have both aesthetic and also functional replica of our patient. And of course, intraoral scanners. Nowadays, intraoral scanner is not something special. It's our everyday tool that we use for everything, for splints, for prosthetics, for surgical guides, and many, many other things. So what new stuff now appeared actually in the dental lab? We all know, by the way, that nowadays, let's be honest, to find a great dental lab is not so easy, especially when we speak about the digital workflow. So in our mVision lab, we go ahead and we do the following things. We do the 3D CAD design. So my lab is preparing all the CAD design for me. No more waxing up. It's all done only digitally. Then we go ahead. We also use the 3D printing. So we print all of our models. We don't use anymore any type of gypsum. Everything is only printed. So for example, I can be working in Kiev and my lab is working distance 700 kilometers away from me, and they can make a design for me, send me the files, I can print them in my office, I can make a mock-up for a patient and demonstrate how the final result is going to look. And by the way, this is how our lab is working internationally. Then the milling process, we don't do any staining anymore. We use only monolithic restorations. Plus, when we use monolithic restorations, if we don't have a layering on it, it means we don't have risks for chipping, because usually the layered part is the part that can chip the most and that we usually have problems with. But nowadays, again, with the new materials and the new shapes, the nice libraries of the teeth, we can mill beautiful restorations and they look aesthetically amazing. And of course, as I said, we are not doing anymore any type of layering. We just go ahead with the staining. So it's just 2-3 hours of staining and we have beautiful restorations. So basically it's quite a simplified approach when we speak about the lab steps, and this is something that we need to have in the modern life: the repeatable workflow and quite simplified workflow, nothing too complicated that can be repeated by different teams around the world. So let's see how we implement all this information in a clinical case.